The second edition of Business World's India Healthcare Summit was held in Delhi recently. The summit saw several industry players and stalwarts discuss the state healthcare reforms, policies and investments. They also brainstormed about the possible ways of tackling the challenges that the industry is presently facing.
Given that there are some of the major challenges that the healthcare industry faces, and especially on the lines of infrastructure, in terms of setting up new hospitals. So what are some of the challenges that you see in terms of, setting up new infrastructure?
Challenges that we face in setting up hospitals, I think one can write a book on them actually. but let's just start with some very basic stuff. What do we need to set up a hospital? I think the fundamental requirement is land. And land today in our country is becoming very, very expensive, almost unaffordable. If we are able to find land in a location that makes sense, we've got to be very lucky. Otherwise, land availability is a huge issue. When we start building a hospital, again, we have to access funds which are either one's own or you have to borrow from the banks at normal lending rates. There isn't any special dispensation that the government actually provides to healthcare providers. Second, I think major bucket of issues that we face is around the permissions and licenses. I was just doing a rough computation. We require roughly 45 to 50 licenses to actually set up a hospital and get it functional. And all these 40, 50 licenses usually are 40, 50 discrete bodies that you actually need to go to within our regulatory system. And that by itself is really a minefield. And from there onwards, I think the other problems that we face are very simply the availability of people. So if you look at the entire compendium, I think to think about setting up a hospital, extremely courageous, and to make it happen is quite a challenge. And unfortunately, in my personal opinion, I don't think healthcare is really top priority agenda for the government.
Ameera, how do you see, this challenges in terms of PPPs, and what are some of the things? Why do you think that PPP is not being successful in the health sector?
I think the challenge is really the way we look at it. We expect PPPs to work in the existing structure of governance. That government says, I've got this much infrastructure, I'll hand it to you, without knowing my costing, without knowing the accounting, without knowing anything. I'm going to give it to you and ask you to run a PPP at the lowest cost, because I believe healthcare should be a social subject and you should be not making profits and giving it on cost from you to the people. So I think the whole construct around the conversation around PPP so far has not been one which can actually build a sustainable model for anybody in the future, be it a hospital, be it diagnostics, be it anybody. So I think unless the government focuses their energy on just doing 3-4 things rather than being a provider of healthcare, if they move on to a payer model, where their job is just to facilitate financial coverage, where their job is to put ethical and structural regulatory reform, where their job is to do health awareness to the consumers and educate them on what differentiates good from bad and who's a preferred provider and who's not. And therefore, remove all the fly-by-night operators who are functioning today without minimum standards and actually spoiling the reputation of healthcare out there.
Dr. Jairam, affordable healthcare and patient safety being major concerns, and like Ameera mentioned, how to make this quality healthcare really at an affordable cost. Is that a possibility?
The ultimate aim of quality is actually to provide better care at an improved cost. Where are we in India today as far as quality is concerned? Abysmally low, and unfortunately at that. There is no regulation to ensure that data is formulated and passed on to appropriate authorities to understand the level of quality, to understand the safety practices today. Do we wish to enter into an era where there is governance of this by a statutory body appointed by the government? Very clearly no. That would really not be appropriate for us. It would defeat its purpose. But it is important that self-regulation by the industry, of the industry and for the industry is something that happens. This is the only way that quality can move forward.
Manoj, you know, when we talk of technology, what are some of the concerns of the healthcare sector and that you think technology will help overcome?
I perhaps am the only one on this panel who doesn't belong to medical fraternity, and therefore I should be able to bring in a new perspective to this entire discussion. So you spoke about the challenges we are facing in the healthcare sector. I think first and foremost we need to look at what kind of investment are we making in the healthcare segment. Our investment in healthcare in India is abysmally low, just about 4 to 5% of our GDP, which compares rather poorly with the investment in some of the developed nations, which actually touches about 10% of the GDP. Again, out of this 4 to 5% which we are investing in healthcare, government investment is very low, just a little over 1%, majority of which goes towards either running the healthcare programs or building infrastructure or paying salaries to the healthcare staff. Very little is actually invested in technology. So far as information technology penetration is concerned, it's a meager 2% of the total investment which we make in healthcare. But moving further on, I would say that a paradigm shift has to take place in the way we look at healthcare. In India, healthcare is all about sick care and not really so much about healthcare. I think we need to definitely spread awareness about healthcare and about the lifestyle management. So I think these are some of the areas where technology can play a very significant role through a proper policy which the government can introduce by having a proper vision on how to promote healthcare in the country.